welcome back. In the studio with me now to talk about a lot of things connected with the CHEO Foundation. Steve Reed, who is the president and CEO, is now with me. Welcome to the program.
Thank you, Doreen. Nice to be here.
Hey, it's always nice to talk to you. It's always nice to find out what is going on in Ottawa at CHEO. Because, you know, you do so much through the foundation. It's always nice to have that connection because so many people, well, especially the young people, end up going to CHEO for procedures. You
know, one of the things I always find in my work is that I don't have to speak to somebody for very long before you start to make some kind of a connection, some kind of a story with CHEO, whether it be themselves, a neighbor, a family member, a colleague, co-member of a sports team. Yeah. Somebody's got a story close to them that involves CHEO.
You got it. You got it. So what I'd like to do is talk about the teddy bear picnic, because that was just recent.
It was.
Yeah. And I mean, you were having fun.
That's the
point.
You
were. I saw a clip and I thought, aha, he's working very hard.
Yeah. Well, I mean, we work hard to put it on, but it's a fun event, of course. And it's been 5 years. So we were really happy to be able to put back on display for everybody the teddy bear picnic and to invite people from the community to come. It was our way to really just say thank you. It's not a fundraiser per se. It's really just a way of inviting the community who supports us over the course of the year to come and join us with a little bit of fun and take advantage of the good weather and all the neat things that we can do for kids.
So what was it like to see the children with their stuffed animals or dolls or whatever and going over to have a Band-Aid put on or to wrap one of the limbs? What was it like?
It's the best. I think it's the best part of the teddy bear picnic. It's the thing that I think people associate the most with the picnic is the bear tent or the bear hospital, as we call it, where little stuffed animals can come for repair, and we have our doctors and surgeons and nurses there on staff to help them out with whatever is needed to bring those stuffed animals back into good health.
And I think it's so nice and so fun to listen to the child talking to the professional about their teddy bear.
One little guy that we helped with his stuffed animal said that he had a broken bone in his belly. And that was,
a broken bone. So I think I heard that too.
We're happy to help him with a broken bone in the belly.
Well, it's nice to have it back, and it looks like you guys were having a lot of fun.
We did. It was one of those things where we recognized midway through our planning that with a 5-year hiatus, it might have been almost an entirely new crew of people that were coming out to enjoy. So it was really nice to see so many. We had over 3,000 people out, and the weather always helps. It was a beautiful day, but it was neat to see the smiles on faces, and we said at the time that's really the only measure of success is lots of smiles and lots of people having fun, and that's what we saw.
Yeah, and it was great. So 2 weeks ago, the 41st CHEO Telethon, right?
Yes, exactly.
And you did very well.
We did. Yeah, we're very, pleased with the results of it. But as much as anything, it's much in the same way as we said about the teddy bear picnic. It's an opportunity for us to engage with the community, remind everybody of the good work that happens at CHEO. Yes. We tell a lot of stories. We have a lot of families that share their story with the viewers. So it's a chance to just remind everyone of the importance of having a world-class pediatric center in our community, but also a way to say thank you and to remind people how important their contributions and philanthropic support are responsible for making that possible. So.
And what is interesting about this telethon, like the campaign only ran for 2 weeks, right?
Yeah, so we did a couple things differently to try to engage with more people. With in the past, if your viewers have watched the telethon in the past, they'll know that it was concentrated into one weekend, and we decided we'd try to reach more people by expanding it over the course of a week. And so we had some support through local media to be able to say, let's come on in the mornings and the evenings and the news and that sort of thing, and tell some stories that way, and encourage people to donate either by picking up the phone or donating online, and that proved to be quite successful.
It really did. It did indeed. You never know when you change something up whether or not it's going to be beneficial.
That's right. Yeah. That's right. And so thankfully, we were able to reach lots of people who were inspired by the stories. And once again, we had some great support.
So 50 years, that's quite a milestone for the foundation, isn't it?
Yeah, we celebrated our 50th birthday, so we opened our doors in 1974. So we've had a little fun with that over the last little while. Just it gives us an opportunity to think back into the archives and remind ourselves of, there's some just incredible stories about how CHEO came to be, and it really dates back long before 1974. You can imagine there was first it was an idea, then there was some political pressure and some support through some of the local politicians to make it part of a mayoral campaign, and ultimately some provincial support, and it was 1966 when the provincial government finally gave their okay, and so construction got started shortly thereafter, and in 1974 we opened our doors, so we're 50 years old.
Amazing, isn't it?
Yeah.
Absolutely amazing. Where do the children come from?
Oh, our catchment area is, certainly compared to 1974, when it was really an Ottawa-based institution.
Yes.
Since that time, our catchment area has grown significantly. So Eastern Ontario, certainly, where the acronym CHEO initially came from. But part of the reason why we go by CHEO now instead of the Children's Hospital of Eastern Ontario is because we're much broader in our scope than just Eastern Ontario. Western Quebec is a big part of our catchment area. Northern Ontario, we're a formal referral site for the territory of Nunavut, and we see people coming from all over the country for specialty treatment, in fact, from all over the world.
That's amazing.
Yeah.
That really is. I mean, to know that it's so close to us, and that if we have a problem, we can take our child,
We're very lucky to have the hospital, to have the research institute, to have all that kind of expertise right in our backyard.
Well, there's so much. I mean, I was reading a little bit more about CHEO as I was formulating my questions. And I mean, mental health treatment, rehab services. It's a training hospital as well.
It is. So we have a formal affiliation with the University of Ottawa and their medical school there. So we are a teaching hospital, and so we see a lot of residents and a lot of learners that are coming through CHEO, helping patients, but also learning and taking advantage of the expertise that's on site. And
I didn't look at it as that. I looked at it from the health point of view, not as also training.
Yeah, no,
amazing.
It's a very big part of what we do.
Tell us about One Door for Care.
So it's an exciting project in our future. So, one of the challenges, and again, I'll go back to the reference to 1974. When we opened in 1974, the population of this region, of course, was much less than it is now, less than half of what it is in our region. And that's before we, as you say, expanded our services, expanded our catchment area. So the biggest challenge we face right now is we're just too small. And the population of kids and youth in the Ottawa-Gatineau region is growing at a much faster pace than anywhere else in Ontario. So it's a challenge for us to reach all the kids that need us. So part of the solution to that is to have more programming. Part of it is to have more staff, and part of it is to have more physical space. And so the physical space part is what you're referring to. We have an integrated treatment center that will be built on our campus, and we refer to that as One Door for Care. So in the next couple of years, we'll start the construction. Right now, we have to build a parking garage because it's going to be on our parking lot. So we have to find a place for cars. So if you drove by the campus today, you'd see a parking garage in the midst of being constructed. And as soon as that's done, we'll turn our attention to building the integrated treatment center.
So when do you think there's a possibility of them actually opening the door?
The plan at the moment is to begin construction in just about a year's time, so spring of next year, to be completed in 2027 and opened once fully commissioned in 2028. So early 2028 is when we hope to open One Door for Care.
Isn't that amazing? Yeah. Wow. I can't get over what, the communities. I was just talking previously with another individual about an event that they're having here in Brockville, and the community was so giving. It's amazing.
It's a very giving community here in Brockville. It's a very giving community in Eastern Ontario, and we're very lucky to be in a place where that kind of kindness and generosity is supporting the type of investments that are going to help us all. And I think there's a lot of hospital campaigns. There's a lot of other campaigns out there, all noble causes, and thankfully we're in a community that supports that, and as a result, it builds a stronger community.
As a foundation, do you have any idea as to what your fundraising efforts monetarily will be?
Well, we know the size of our campaign. So when we sat down with our counterparts at CHEO, and they outlined, their plans for not just Wonder for Care, but for some other renovations and modernizing of our existing facility as well. Right. When they laid all that out and they looked at the total costs and what they anticipated to get in funding, that left a gap. And we're that gap. So we're going to fill in that gap with support from the community. And so it's a big number. It's over $200 million. But over the next number of years, we'll be working with our community and our corporate partners and that sort of thing to raise that money and support the great initiatives that they have in front of them.
It sounds like a huge number. But as you say, if over that period of time,
right,
a chunk here, a chunk there, a chunk, it will all come together. Wow. So have you actually started?
We have.
You have started. So right now you're concentrating on that as well as having other fundraisers at the same time.
That's right. So nothing changes in terms of what we need to support annually. So those needs don't go away while we're trying to also build some extra capacity. So we're continuing to support CHEO, the hospital. We're supporting the Research Institute and Roger Nielsen Children's Hospice as well. So all three of those organizations count on us for annual support. And then on top of that, we're counting on our community and working with our philanthropists to support the expansions and the new facilities that will take us into the future.
I'm going to throw a question out to you. I don't know whether or not I'm putting you on the spot. Probably not very nice of me, but do you have any idea from Leeds and Grenville how many children would have had gone to CHEO for whatever the need was? And just any idea as to, like, are we talking 10? Are we talking 100? Are we talking 200? Any idea?
It's in the thousands in visits. So one of the challenges in answering a question like that is what counts as a unit. So is it a visit? Is it each child, regardless of how many times they come up? But about 2,000 visits from this area. So these would be visits to emerge, visits to clinics, visits to the operating room if a surgical procedure is needed. So
I'm sorry, I didn't mean to put you. I did. I put you on the spot, and I'm sorry.
No.
But I was just curious.
It's a great question, and it's a reminder, I think, and it's an important message for us to get to the outlying communities that, we are the pediatric center for this region, and we have a number of people that count on us for that. We're very lucky in the Brockville region to have, Brockville General and to have tertiary care in Kingston and to have pediatric care in Ottawa. So we live in a good part of the world where we have access to care regardless of our age or our need.
You're right. And a lot of people say, that Brockville is more of a retirement area. Well, you know what? It doesn't matter whether we are or we aren't. There's still children in our area, and they need to be looked at and looked after. So that's...
and if they need it, we'll be there for them.
Yes. Let's talk about... we're actually doing a little bit more here in Brockville at the hospital relative to CHEO with some surgeons coming down on a weekly basis to do some operations.
This is, I think, a great initiative that just shows the power of partnership and the power of collaborating. And I think what we're trying to tackle, as I said, is long wait lists and issues around accessing care. We're very proud of what we can do for kids that get through the doors, but we're very conscious of the fact that there's a lot that can't. Right? So, and a lot from this area, a lot from other areas that have to travel and that sort of thing to get to the care they need at CHEO. So we took advantage of a health team called Kids Come First. That's a collaborative of about 60 different organizations across the region, different agencies and so on that all work together. And we said, is there a way we could perhaps add some capacity to the surgical program in the area by working with Brockville General, working with Carleton Place District Hospital, adding some capacity, but also bringing care a little closer to home for those that need it in the areas that are represented by those hospitals. So if you're a parent of a young child here in Brockville who needs some support through a surgical program at CHEO, it's quite likely that you may be able to have that procedure done here at Brockville General thanks to that new collaboration.
Isn't that amazing?
It's great for the families, and it's great for adding capacity, and it's great for trying to tackle some of those wait times.
I love it. Absolutely love it. You just, sometimes you're not aware of what's happening in your own community. It's true. Unfortunately, it's true. And I just love this. I just think it's so, as you say, it's a partnership and it's working well. Yeah,
it is. And I think we look at it as a bit of a pilot project that we're hoping to expand into other areas as well, because, you know, I think if it can be managed, you know, in terms of the medical expertise and that sort of thing, then it certainly brings care closer to home, and it starts to, as I say, tackle some of the wait lists that we're facing in Ottawa.
Yeah. Yeah, it does. Steve, is there anything else that you would like our viewers to know about the CHEO or the CHEO Foundation?
Well, just, I would like to thank everybody from the area that is helping us with the vision we have to increase the capacity for pediatric care in the region. We are very proud to be able to support this area as well as all the areas that I mentioned earlier in our catchment area, and we look forward to working with the foundation here in Brockville to make sure that we're, you know, providing all the right infrastructure for care here in Brockville as well as pediatric care in Ottawa.
It's all about the children, isn't it?
It certainly is.
Okay. Thank you for sitting down with me.
Doreen.
I appreciate it.